Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello. Thank you for joining us for today's webinar, Improving Your Bottom Line with Better Provider Relationships and Smarter Technology. My name is Brian Nelson, and I'm a product manager here at Axxess. Joining us today is Tim Ingram and Christina Andrews from Axxess, and also Laura Montesantos from Procure. Christina Andrews is a director of professional services at Axxess, where she delivers practical operational solutions to scale using technology for home health, home care, hospice, and palliative sectors. Prior to joining Axxess, she was a senior manager of growth solutions at Symmetry Healthcare Consulting, formerly known as Simeon Healthcare Consulting. Now a little bit about Laura. Laura Montesantos is Procura's Vice President of Product Management. She has more than a decade of experience in strategic vision and ownership of product development, integration, implementation, and support. She's worked in the healthcare software industry on both provider and payer solutions. She leads product management in developing and enhancing Procura's suite of offerings. Laura previously served as Director of Solutions, Integrated Products for the Anthem affiliate AIM Specialty Health, as well as a Solution Manager for Allscripts Corporation. And finally, Tim Ingram. Tim serves as the Senior Vice President of Business Development at Axxess. Tim is responsible for leading the business development team to build valuable industry partnerships and key product integrations that create solutions for Axxess clients. Prior to joining Axxess in February of 2018, Tim served as the Regional Administrator for Encompass Home Health and Vice President of Sales for Home Care Home Base, among other industry positions. Just a few housekeeping items before we begin. Your phones have been muted, but you may submit questions through the chat function in the control panel. If we have time, we will answer as many questions as possible and follow up on any unanswered questions after the webinar. Slides from today's presentations, along with the recording of the webinar, will be available and be sent to those who registered via email. The slides are also available in the handout section of the control panel. And now, Tim, over to you.
Thank you, Brian, and thank you, Christina and Laura, for joining me this morning, and for everyone who has joined online. We're so grateful for the time we're going to spend together today. And at a very broad level, we want to take a post-pandemic view, if you will, being as positive as I can be that we are post-pandemic, and we want to revisit how things have always been done. And we are going to speak a little bit about workforce and how we, together with better provider relationships between the providers and the referral sources, and also better relationships between the providers, the referral sources, and their technology, how we can lessen the load on caregivers and clinicians. And what you see in front of you now is really an overview of the Axxess ecosystem, as we call it. And at Axxess, we are very vision and mission driven. We believe deeply that the future of healthcare is in the home. And because of that, our vision is to be the most successful global healthcare technology company and most admired for its people, partnerships, and solutions. And so today we get to be joined by two incredible people, and we will be discussing the partnership and a little bit about the solutions as well. And our mission is to empower healthcare organizations and professionals with the world's best technology solution. And you see, as I mentioned in front of you, really a snapshot of the ecosystem that we have through the Axxess solutions. And there are people who refer to us as an EMR, and we bristle a little bit about that. And I think you can see why on this slide, because we provide so much more than just an electronic medical record. And Brian, on the next slide, what we're going to talk about briefly as an introduction to Forcura, for those who may not be aware. Over the last decade, Forcura found that many agencies had difficulty monitoring their incoming referrals, as those referrals came in from various sources. They spent too much money in administrative costs, and then they spent too much time onboarding patient records rather than reviewing patient information and actually caring for the patients. So why did we decide at Axxess to partner with Forcura? Well, that's a good question. I'm glad you asked. And really, some of the key reasons Axxess has partnered with Forcura is that they have been doing this for over 10 years, focused on our industry, and they know that there is a direct relationship between the health of your revenue cycle and the health of your business, the morale of your staff, and your patient outcomes. So Christina and Laura, let's dive in. And I've got a few questions today about this whole concept around technology and provider relations and making things easier, both for the providers and for their referral sources. Christina, let's start with you. Could you give us a state of the nation on the care at home industry thus far into the pandemic?
Yeah, when we took a look at the patients that were being accepted into care, organizations across the board, East Coast to West Coast, really saw a shift in their referral mix, as well as their acuity. Hospital referrals at large, we saw an increase in the home health segment with a decrease in the skilled nursing facility segment. In some markets, that percentage was around 35 to 40%. So what does this mean? It really means that the acuity and the complexity of the patients being cared for in the home, it shifted. Physicians, when we think about them, previously, they were much more inclined to refer their patients to a facility setting, but now they're really embracing their patients receiving that care in the home setting. When we think about some drivers of that, really it came down to the patients themselves as well as families. Patients still are, concerned about contracting COVID while in that inpatient setting, and families, especially when it comes to end-of-life care, they weren't able to be with their loved ones if they were in an inpatient setting. So choosing care in the home has been embraced, through patient population as well as family and into that physician segment. When we looked into some of the statistics in 2020, it was reported that home health indicated 10% of their primary diagnosis was COVID. To whereas before, we saw things such as kidney disease, heart failure, respiratory, and within hospice, the same thing. COVID becoming more of a primary was Alzheimer's, dementia, and I think it was Parkinson's thereafter. Tim, we know that when we look at these patients, it's not just one diagnosis that our caregivers are having to care for, right? Mm-hmm. And to manage. They suffer from 5 or more. And so that complexity was just heightened during the pandemic. So this really required organizations to think differently about how they're going to become more specialized, through addressing that acuity, whether it was investing in top talent, through education, as well as telemedicine and telehealth.
Okay, so with knowing that or hearing you talk about that, a couple of follow-up questions, really maybe a 2-part single question. So where should, as patient advocates, where should their focus be? And then based on what that focus should be, how are organizations adapting to minimize the stress on their caregivers and clinicians?
Yeah, great question. Oh, goodness. So when we think about work-life balance, or as we like to call it, work-life integration, this has been extremely difficult, and it still continues to be difficult for most people. Balancing that change that has occurred, not only in our personal lives, but our professional lives, has added an undue level of stress. So what we're seeing in the healthcare industry is we have individuals who are really leaning in and racing into this, to make a change, to make a difference. And then we have some who are leaning out. So there's a silver tsunami coming, right? So when we think about it, by I think 2050, we are looking to have around 88 point something million Americans eligible for their Medicare benefit. And so if we have some of that workforce leaning out, it definitely is going to impact our workforce scarcity, right? Tim, your favorite word, workforce scarcity. In a way that it's going to continue to see a rise in that overall percentage. I recently read a report from ShiftMed that stated that almost half of the U.S. nurses are at least somewhat likely to leave their professions in the upcoming 2 years. I believe 38% are planning to pursue non-patient facing roles in healthcare. 31 are planning to leave home health altogether. And 30% are looking to reduce their hours. So when we think about that, that turnover, it really impacts organizations, and it also impacts care delivery. And when you look at that cost, it could really cost an organization anywhere from a roughly 30,000 up to like 52,000 as it relates to that turnover burden. So what are organizations having to do to lean in a different way? They've really been assessing the employee experience, and that employee experience starts with recruiting to onboarding all the way through that life cycle journey within an organization. I love stats. Another great statistic. 2019, the Gallup polls stated that 70% of our employees are experiencing burnout. That's 8 out of 10 employees. I mean, so could we imagine when the study comes out in 2020 of what that burnout looks like due to COVID? So some of the things that were reported was workflow is equivalent to 2 full-time jobs, right? So now we have the surges in that workload due to COVID because we have individuals who are leaning out, infection control management, having to cover for staff. Other components such as orientation, it's just not adequate, and the training is poorly structured. People who dive into healthcare, they're really wanting purpose and meaning from their work. And so this is where organizations are leaning into that engagement because they have to nurture it at the end of the day, which does require a two-way relationship. So first, I would say that we have to get back to aligning efforts with mission and vision. And Tim, you kicked us off with our vision at Axxess, and you had mentioned how, it's people, partnerships, right? And so you have to align the efforts with the mission and vision. Because clinicians do not sign up for transactional care. They sign up because of the relationships and the impact that they make in daily lives. Secondly, I would say organizations should lean in and really focus on the strategy for caregiver orientation, ongoing training, and mentorship. And then last but not least, when we think about that workload, this is where, partnering with the right technology partner that enables ease of use of that care delivery is crucial. So, from the front line all the way to the back office, weaving in that control flexibility, in addition to ensuring that your partner is deeply committed to the future of healthcare in the home, and picking the right interoperability partners to help with that ease of use.
Wow, there's a lot to unpack there. We could probably spend about 30 or 45 minutes just talking about that. But Laura, I've got a question for you now. Given what Christina has just shared with us, what, in your opinion, what is the state of the nation in care at home in terms of technology? We talked about staff, we talked about the organizations, but what about technology?
So technology is facing some of those similar challenges in a little bit different way. So the things that Christina mentioned around staff shortages, staff burnout, has really caused the industry to have to think about their focus, where often technology vendors are really focused on innovation and really the shiny new object that's out there to provide for the users. But the pivot has been in technology is really rethinking those technology solutions and focusing them and aligning them, as Christina so well stated, on the needs of those users. So I like to say that technology needs to meet those users where they are. And what that means sometimes is maybe instead of focusing on that really new innovation that's out there, is really thinking and hearing what the clients need in terms of technology, and then providing solutions that often can be disruptive in and of itself. Less staff, more burnout, trickles to technology implementation as far as training and retraining. And that reprioritization has to do exactly with that realignment in ease of use and really meeting those users with the needs of today. So the response from technology is really a shift. I think it's a big shift for technology. stepping back maybe and thinking about what solutions can really partner up with those users in terms of meeting the needs of today.
So it almost sounds like the technology's got to be able to help with change management as much with the new shiny thing that's on the market. Interesting. Thank you. So Christina and Laura, this is really for both of y'all in a two-part question again. We know that the best referral partner relationships really start with how the new patient referrals are accepted into care for the organization. So Christina, let's start with you. Can you talk more specifically, given our topic, we're talking about provider relations and technology, not just the pandemic and the providers themselves. So Christina, can you talk more specifically about the physician new front door for the care at home industry? So the business development teams for the provider as that relates to the partners, or excuse me, to the referral patterns.
Yeah, most definitely. So, I hesitate to say that it's a new front door, but when we look at those organizations across the board, you have some who had a high percentage of referral patterns coming from that physician segment, and those who did not have a large percentage of referral patterns coming from physicians. So it has opened up the door for some. And, so that physician stream is representing great growth opportunity for many organizations. So the business development team really leaning in to understand their markets, to help drive that strategy of care in the home by capturing patients further upstream, right, within their journey. So utilizing your technology partner, I would say that reviewing your referral trends, your patterns, timeliness of care, assessing your attending physicians, the associated diagnosis and patterns is also going to be important with that overall strategy. But then what does that call frequency look like in the sales pattern? Because to create that upstream referral pattern from the provider world, we have to have diversification, within sales calls. So we're not just spending time in hospital or skilled nursing settings. Where you spend your time is where you get results. So then I think about that external relationship and how that drives the referrals into our technology partners. So intake's ability to say yes, right? At the end of the day, that's what really separates organizations. Ease of use and the ability to say yes. So how are you currently structured to take referrals? Back in the day, I talked a lot about evening and weekends, but now, how are we quickly assessing capacity issues, live time? So how does your technology allow you to do that through scheduling components? How do your interoperability partnerships increase the speed of use intake within that intake process? So not only of accepting those external documents, but how it manages those documents for quick review to saying yes, right? So when I was business development liaison back in the day, I remembered I always, I would use the opportunity to go and track down orders, to go and track down that face-to-face, to go and track down any other component that would help build the case of eligibility. And so was that the best use of my time? Was I working at the top of my license? I mean, I tried to make best use of it by saying, I'm here today to pick up X, Y, and Z for a mutual patient. Is there anyone else that I could serve today that you met with yesterday who has a similar diagnosis? So I would always try to capitalize on, that administrative burden of tracking down what was needed from the providers. So if I would have had some of that technology that I know Laura's going to talk a little bit about today, back in the day, it might have looked a little bit differently for my strategy.
That's whether intentional or not, that's a great segue. So Laura, let me ask you a question. How can care at home agencies quickly accept new patients into care?
Yes. So Forcura, using the Forcura platform, thank you. We are a care coordination platform at our core, and we're really helping those agencies with document management, which, as Christina stated, is very complicated. It's often fax-based traffic. It's community-based referrals coming in from all sorts of sources, and organizing those documents and presenting them to the users in a way where they can get quick to yes and quick to intake is really the goal. So here you see an example of our dashboard. We organize the documents that come into the system and categorize them and prioritize them through automated technology. You'll see an example of how documents that come into the system are organized based on those categories, referrals and non-referrals, so that users can click on what we create at a dashboard level, a high-level view of those documents that are coming in, and allow the users to act on the priority referral documents in a quick, efficient way. And the Forcura platform is designed so it's very workflow driven. It can be customizable. I know that's a bad word in technology, customizable, but we are not code customized. We are configuration customized. So we support different workflow components of different agencies, allowing the system to be organized in a way that works for that agency and those specific workflows. So what we do with status-driven workflows is allow the users to see at a high level what documents are coming in, what are referrals, click on the high-level information to drill into those details, view the patient information that's very important in order to understand if that patient can be onboarded, that quick to yes that Christina mentioned, and then any subsequent processes that accompany that onboarding in order to get that patient, that intake process accepted and completed quickly. One of the most exciting features of the Forcura platform is the integration with Axxess. So the work that's done on the detail level can be automatically integrated and transferred into the Axxess system to help minimize further duplication of effort with data entry and processes that would have to happen via paper systems, very manual based. So we're automating that workflow and helping for a quicker yes for that intake process.
You read my mind with that last part. I was going to ask you specifically about how the Procure integration with Axxess helps keep the workflows fast. Again, to Christina's point, fast to yes, but I think you've already answered that. Just to make sure, though, is there anything else specifically about the integration between Procure and Axxess that you want to call out here?
Yeah, it's really about the duplication of effort and taking away that requirement. So any work that's done during the intake process on the Forcura platform, data prepopulation, patient attachment, the integration allows that information to flow seamlessly into Axxess and then minimize those extra keystrokes required.
Excellent. Thank you. Christina, let's go back to you. Can you speak about how behind all of those unsigned orders you mentioned going earlier and sitting to get an unsigned order, behind all of those unsigned orders are people that are actually waiting to receive care. And there's also a little more to be worried about here too. Why are unsigned orders or late orders bad for business?
Great question, Tim. I've got to lean back into, those, at the end of the day, those are patients that are waiting to receive care, right? And when there's barriers that are enabling us to provide that care, they must be eliminated. That's the operator and the sales mindset of me. So what happens is we know, each day of care that is missed, that is increasing risk. It's increasing risk for that patient, for that family, potentially equating to rehospitalizations. So we think about that referral partner relationship. If that patient winds back up in the hospital, our hospitals are tracking that, right? Our hospital systems are tracking rehospitalizations because it impacts potentially their reimbursement. But then they're also saying, okay, well, who's going to be my referral partner in the future? How are they minimizing these barriers to helping our patients receive the care that they're entitled to and that they need today. Then when I think about the operator side, each day of care that is not being received is revenue loss. So we might be managing those pending patients through your technology partner. So each pending day is revenue lost, it's care missed, it's risk of impacting our overall relationships. And then also when I think about that administrative burden, that equates to cost. So we don't have the revenue that's offsetting that administrative burden as it relates to that expense. So we might be looking at our days outstanding, a word that none of us operators like to use, write-offs. It's not a word that we like to use. Potential RAP penalties, and creating cash flow issues. So it's a mixture of financially the success of an organization, those clinical outcomes, the success for the patient, for the family, and for the organization, and then future state that market share growth. So it really does impact. I'm going to use three buckets for this answer. It does impact those three buckets.
I love that thought process that behind those unsigned orders, it's not just revenue, it's a patient waiting to receive care. Thank you for saying that. Laura, how will Axxess integration with Forcura help to make orders management more efficient, since now that Christina has talked about there's really a patient waiting to get service, it's not just an order that's unsigned. So how does the integration help?
Yeah, there's two basic components I'll speak about today for that help with the integration. One is the integration itself. So the data that's flowing from Axxess into Forcura can be constructed. I'm going to ask if you forward the slide a bit so we can get a visual of the order management. One more slide. Thank you. Yep, there we go. So the information is flowing from Axxess directly into the Forcura platform. And as stated with the referral management and intake, the dashboard is created for a high-level view of those days outstanding for the orders. So not only are the orders managed with that direct integration, they're sent out of the Forcura system to the physician in a preferred delivery method. And then the agency users have high-level visibility of how long those orders are pending. You see here that you can track those orders on the different category of how long they've been outstanding. The users also have visibility from an analytics perspective, and then they're allowed to drill into the detail and see exactly what orders are out there for better management, better prioritization, and figuring out how to get those orders signed in an efficient method. So if we go one more slide, I'll show you an example of drilling into the detail and how that can help organize the prioritization. So here we are looking at an example of the Forcura provider dashboard. So underneath the order detail is the providers that are associated with those orders and those outstanding signatures. You can see all outstanding orders for that specific physician, and how that helps is if there's more than one order outstanding, the user who's responsible for kind of chasing down that signature knows that there's one or more orders for that organization. The system allows resending. So if you have to resend that order, maybe as a reminder, you can do that directly from the system. You can also make notes for other users to understand that follow-up has already taken place. So you're not over corresponding to that office if, say, your coworker sent out or resent out those orders that are pending signature just yesterday. You don't want to be sending those out perhaps the same day or next. So really managing that order workflow through the system and having visibility on the real-time aging of those orders, and then supplement it with analysis through the analytics component that Christina talked about to really understand your referral partners, your order partners, and understand the relationship and know how to work towards enhancing that for better communication and response, and ultimately better turnaround time.
Okay. So, Christina, we've talked about technology. We've talked about how that can have a positive impact on the organizations providing care. But what are some of the boots on the ground impacts of physicians slowly accepting technology or adopting technology?
Yeah, I go back to, the thought process of ease of use, right? And so how are we providing that education related to ease of use? So a role that liaisons and business development and organizations can play with that is, what techniques, what tools are you using to help provide that education to physicians on ease of use through adopting the technology, but also providing, information on how barrier to adapting technology, is impacting, as we just talked about previously, that patient getting the care when he or she, needs it, is entitled to it, and deserves it. The bottlenecking within our hospital system, as it relates to discharge and transition discharge plans, and the administrative burden. So I talked a little bit about when I was that liaison back in the day, but I think about, the administrative days, to where I had a process in place where we had team coordinators who would pick up the phone and call physician's office, in the AM, tracking down those orders. They would then call at lunchtime to track down those orders, and they would call at the end of the day to track down those orders. So now you have administrative burden on the home health or hospice organization, but you also got the administrative burden in the physician's office. So now we have FTEs who are not working to the top of their license or the top of their role, which does equate to additional expense. It equates to time management issues. It equates to productivity issues. And then it goes back to that burnout that we talked about earlier. They're not able to complete, their functions throughout the day. So if the team coordinators weren't able to obtain, that connectivity of that order, and chasing down the faxes in the morning and the afternoon, and who covered the fax machine in the evening, that's when you had to get someone, more in a director level position involved. So when you have a director having to reach out to a physician office to track down those orders, again, it's employee morale. They're not focused on care delivery of the patients who are actually on service, because they're trying to get patients onto service. And so it's just a negative feedback loop. And really, it boils down to that overall outcome. What is that experience for that patient? What is that experience for the organization, the home health hospice agency? And what is that experience for the physician's office and all of the staff involved? So, really, how that education is being provided. Physicians love data. And so how does that technology impact that data in a positive way that the physician can lean in and be much more open to adopting technology of helping his or her patients get care sooner and further up the stream?
Interesting. Thank you. So, Laura, let's go back to you. We've had some discussions before about this interesting paradox about primary care physicians. How does that play out with this concept of getting the order signed?
Yes. So Christina talked about what physicians love. I'm going to talk about what they don't love. And it's really important to acknowledge it when you're building new technology, because if you don't, you really have an uphill battle in adoption from physicians. So I think physician users are very unique. It's a great group of users, but they have specific pain points that I think need to be acknowledged and identified when building solutions that are specific for those needs. We talked at the beginning, or I talked about meeting the users where they are. This is one of those examples where you need to meet the physicians where they are. and that means meeting their expectations. So, for example, Forcura has just built a new electronic signature platform that we're going to talk about in a minute. So in building that solution, thinking about that adoption, we thought about some of those pain points and the fact that physicians aren't what I call technology adverse. They love technology. They're what I call technology suspect. And rightfully so. I think over the last decade that there was a lot of promise to the physician user base that technology would really help with administrative burden. It would reduce that. It would give them more time for patient care. In a lot of respects, though, they were disappointed at the fact that there was more requirements around the technology than they expected. So with that said, some of the pain points that need to be really a focal point when building physician-focused solutions include username and passwords. Physicians do not like to log into multiple systems to use new technologies and have to remember username and passwords. They also report anecdotally, but this you could read, lots of industry reports and statistics around the ability to do bulk functions. So very administrative functions that are repetitive, they want to be able to do in a bulk fashion. So that was another main criteria in building the new solution. The concept of alert fatigue came into the thought process. Often there's alerts that pop up on physician screens. And what happens, and this happens to other users as well, we deal with this every day where you get alerts and pop-ups and you just dismiss them. You don't even read them half the time. So being very aware of that alert fatigue. And then finally, clicks, the number of clicks. It seems a bit cliche, but those physicians will really count how many clicks it takes to perform an action. And if it's too many, they'll let you know, and that adoption rate can really suffer.
Interesting. Alert fatigue. I love that concept and how so many great technology solutions actually aid and abet alert fatigue, if you will. So Laura, let's stick with you. I've got another question. So what is Forcura's solution for getting more orders signed electronically, given what you just told us?
Yes. So if we go to the next slide, we have, over the summer, we released a new product called Forcura Circle. It's Forcura's e-signature platform for physicians. And we really focused on the points that I just discussed in developing this new technology. So I'll give you some examples of how Forcura Circle works. As we discussed in the order management module, those orders flow from Axxess into Forcura. And then the delivery method for physicians who adopt the Forcura Circle solution can be sent to those physicians electronically. The registration process for physicians is very easy. The agency sends those physicians a link to register for the Circle platform. And with some minimal data, they can be registered for the system. And what we do with that data is when the physician logs into the platform, you see a screenshot here, if you could see it in the middle, rather than a username and password and having to remember that every time they log in, the physician receives a security code that they could enter in to access the platform. So that was in an effort to minimize that, 100 username and passwords that you write down and keep under your computer that you're not supposed to. But then when accessing the system, the physician can see all the orders that are open and outstanding in one place. So Christina, you talked about that ease of use. This was very important. There's two basic features that the physician wants to do when they see those orders. And I think on the next slide, we have an example of the work list. So here you see all the orders that are outstanding for that physician. Viewing and signing are really the main functions that the physician needs to do here. We show some minimal patient data to give the physician an idea of what's outstanding. And then you'll notice, importantly, on the left side, there's that checkbox feature allowing the physician to do bulk actions with those orders. So in this example, the user can select multiple orders that are outstanding, either view or sign those orders. Once they come up on the screen with one click, the physician can bulk sign all the orders that are outstanding. So that's very helpful in that ease of use category, as well as the bulk action that I talked about. We also have the concept of allowing physicians to include their staff in the process. So if they want to include staff members, so the staff can go in and approve those orders, we have functionality where the orders can be approved. And then the physician doesn't have to go through that view and review process. They can just click one button and sign those orders. I'll talk about a couple additional features that we feel are real differentiators in the market. One is physicians can see orders across different agency branches or different agencies. So other electronic signature solutions require physicians to log into multiple platforms to sign those orders electronically. In the Forcura platform, those physicians can do that all in one place. And then there's also a rejection option here, where if the order was sent by mistake or to the wrong physician, that physician can indicate they're rejecting the order. It will flow back into the Forcura platform, and then the user, the agency user, can quickly send it out to the correct physician. And if you think about what that takes in a manual world, that could be weeks and weeks before that order finally gets reviewed, identified as incorrectly sent, and then resent out to the correct physician for that process to start over again. So that will really help expedite that turnaround time we talked about, the patient component, and the billing and payment. And one last thing, we can't not address our alert fatigue. So we allow physicians through that account management within their own system to determine when they get alerts for orders that are outstanding. And I'm sure the agencies would like that to be, once an hour, but physicians determine whether it's weekly or daily, and then what time of day they get alerted. So really focusing on those pain points with the solution. We've had great adoption since we released Forcura Circle this summer. And again, the most exciting piece about Forcura Circle is with the Axxess integration, those orders, once signed, can flow back into the Forcura platform for review by the agency users, or based on the agency configuration, it could flow directly into the Axxess system upon signature. So very exciting.
Yeah, that is. That's awesome. I love how Forcura has dealt with that alert fatigue and really being a great partner with Axxess. And I think it's a combination of two great technologies and two great companies partnering together. So Christina and Laura, let me see if I can summarize sort of at a high level, thinking about the conversations that we've had today. So when organizations are looking for a technology partner, and that's the way we think of ourselves at Axxess, and I've learned from Forcura that you think of yourselves that way as well, not a vendor, but a partner, and a true partner. So first of all, organizations, I think, should probably look for someone that is integrated and highly interoperable. And I know that's a fancy word that's thrown about a lot, but at the end of the day, what that means is organizations that have the ability to make your life easier, not just through connections, but through true integrations. The solution should be integrated together. I think another thing that I've heard is that whether it's a physician or it's an organization providing service or an end user, a clinician or a caregiver, they should look for technology partners that have outstanding customer service. And not only that, but services to optimize the user experience. What I've experienced personally in the technology arena is that there's a lot of solutions that focus on the organization, but not the end user. And I think that that's important. And I've heard that a little bit today as well. And then maybe the last thing to summarize would be that you want a partner that is innovating together. And Laura, you touched on this, working together with the organizations and the end users. And we do that at Axxess as well. But really innovating, someone who will innovate together to continuously deliver the best experience and the highest return on investment. I heard ROI a couple of times throughout the conversation. And I think that that's important. It's not just someone who can build an interface and then say, okay, it's done, we're interoperable, but someone who can continue to listen to the end user and listen to their other partners from an interoperability standpoint and work together to always find new ways to enhance. And really, enhance should mean make easier the life of the end users and ultimately the patients that we're providing care for. So, Brian, I would like to, first of all, any parting thoughts from Laura? We'll go with you since you spoke last, and then Christina.
I think you said it very well, Tim. Yeah, the interoperability is a big word out there. It's very complicated, but focusing on the user and the connectivity partner is key.
Mm-hmm. Yeah, I would say the same. You summed it up beautifully, Tim. And the word that comes top of mind for me right now is experience, right? So through that partnership, how that service impacts the experience of all of our customers, from organizations to referral partners to the end users being our patient families and caregivers.
Thank you. So, Brian, do we have any questions that have come through in the chat?
Yeah, we'd like to open it up at this time. If anyone has any questions, to go ahead and type those into the chat. I'll pause for a few moments here and see if we have any questions come in.
Well, while we're waiting on questions, Brian, Christina and Laura, I want to thank you both. I know we've had some conversations, the three of us and Brian together, talking about what we want to accomplish in this. And I want to thank both of you. Christina, you mentioned some research that you looked at, and Laura, it's obvious that Procure has done some research as well on end users. So I want to thank you both for the work that you're doing to improve healthcare in the home.
Thank you, Tim.
Thank you, Tim.
Sure. Any questions, Brian?
No, it looks like at this time we do not have any questions. Thank you so much, Christina, Laura, and Tim, for sharing your expertise and your wisdom with all of us. And for everyone on the call, please don't forget that we'll be emailing everyone a link both to the slides and a video recording of the webinar within the next few days. And thank you everyone so much for your time today.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.